Bonjour tout le monde.
Good morning, everybody. 24th of October, 2018. Is that right? This is a day, in my opinion, which is historic. And I hope that it will be a day that is historic in our collective path as well, to bring about this movement of elder abuse towards promotion of the rights of residents. We are there. You've been in the field for years. We've all been yelling, saying that things cannot move on that way. With all the goodwill, the big hearts, and common sense, Hélène Rumak, the founder, used to say that it's a question of GPC and of big hearts and common sense. If we've got these two things, the rest will follow. We will move forward together. There is no perfect solution, but there is a problem for each solution. Unfortunately, for each solution, there's a problem. But the movement is to find new solutions and to adapt to the needs of a person who is changing and the needs of our institutes, our nursing homes, our long-term facilities, which have to make their changes, not just in words, but in their daily actions, in their culture. And I would like to highlight here the fact that we were here in 1995 in this same hotel. Mrs. Rumak would welcome the people at the time. And at the time, the conference was called Breaking the Silence, because we said, well, no, there are some cases of abuse and of neglect, but they're exceptional cases, but now we're not there anymore. It is systemic. And we like to say that if we are part of the system, we are people. First and foremost, before we're a system, we are people. And if we are part of the problem, we are also part of the solution. And I'm happy that thanks to technology, we are being webcast currently. So those of you who are listening to us on the webcast, I don't know where to look at you, but in your heart and in my head, you are here with us, and I thank you for participating in such great numbers. We've got about 130 people who are with us on the webcast, so I welcome you. We will have the opportunity to speak together a little bit later on. We've got a wonderful group of people who will come talk to us today, experts from the resident, who is an expert in his needs, the parent or the friend that accompanies the resident, who is an expert in the needs of the resident. Then there's the staff, the nurse. They are the experts in care, in giving care. Well, we can do it this way or not that way. What if we did it another way? It's not written anywhere in the plan. But yes, I found a good way of brushing their teeth so that she doesn't choke. These are other experts in the field. We've got our nurses, we've got our clinician nurses, and our administrators. So, and then of course we've got our managers, and we've got our politicians, and we've got our population. And then everybody says, well, we can't change the system. This is the way it is. Well, I'm sorry. I am part of the system, so I can make a difference. On this, I hope that you'll have a wonderful day here with us today, and we will begin this meeting with, on the technical side, I'm going to ask, and I'm going to introduce another Hélène Durand, who will explain to you the technical aspects of the meeting. So thank you for being with us. Good morning, everybody, and welcome. So thank you. As Johanne said, thank you for being here and for accepting our invitation to participate. We've worked very hard to organize this day with several experts. So many experts, in fact, that sometimes I'll have to intervene a little bit with my collaborator to make sure that we don't go over time. We don't want to be impolite or restrict your comments, but we really want everybody to have an opportunity to express themselves, and we want to have enough time because we've got a very full day. So this morning, there's going to be a break from 10:15 to 10:30. It's the PP or exercise break so that you can stretch a little bit and so that we can feel in our body like our residents, who sometimes can be 3 or 4 hours in a seated position without moving. So we want to treat you well. So that's what we'll do. We'll have a break. So it's only 15 minutes so that you can go grab a drink and go to the bathroom, because while our speakers get ready for the second part of the day, which is a plenary session, if you need help, we've got some volunteers and some staff from Carpe Diem who are sitting in this section here. Can you please raise your hand so that people can identify you? So if anybody needs anything, if you need to be accompanied or you need anything, please don't be shy. They have offered their services. Furthermore, this afternoon, we will ask you, when we leave for lunch, but I'm going to come back to this, we'll ask you to make sure that you bring all of your things with you, because the rooms will be closed and the workshops, we'll have the workshops this afternoon in smaller groups. So this morning, we're all together. This afternoon, we will be in small groups in workshops. We've got 2 workshops, and we will finish the day, everybody back in this room, perhaps to congratulate ourselves, we hope, and wish you a good drive home. So thank you for your attention. Have a wonderful day. Thank you. We will begin right away this wonderful meeting with somebody that everybody knows. We say Marie. Marie who? Marie Beaulieu, of course. Who has not heard of Marie Beaulieu if you work in this field? She is a pioneer. She is a researcher, so a very bright woman. But mainly, she is a woman with a great big heart, and she's got values, lots of values. So it's a privilege that she accepted to kick off this conference. She is, I believe, she's in Vancouver still. So she will speak to us directly, Leah, via this video that she's prepared for us. So have a wonderful meeting, everybody. Hello. I am Marie Beaulieu. I'm a professor at the University of Sherbrooke. I'm a researcher at the CHUS, and I work in the field of elder abuse. I've been in this field for 31 years. I spent most of my career there. Since 2010, I've had a research chair on elder abuse, a chair that was created in the action plan, the government's action plan, to fight elder abuse. So a chair that is financed by the government of Quebec. Unfortunately, I can't be with you today, and that's why I'm speaking to you via this recorded message. Luckily, 2 members of the chair are with you today, and you will have the opportunity to hear them speak and to speak with them to understand our point of view. So I welcome you to this conference, which is organized by Handicap-Vie-Dignité. The title of the conference is very significant to me. And even if it's long, I will read it to you because I will comment on this. It says, "Together, promoting quality of life for residents." Handicap-Vie-Dignité's conference on the rights of residents and how to advocate for them in public long-term care settings. So I'm coming back on 3 words, and the first of my comments has to do with the notion of togetherness. This indicates that we are in an approach that is created or based on partnerships. It's not an isolated action, but a group of people, that is you, who care about the interests of people in long-term care settings. So this group could be comprised of residents, of members of their families, members of the user committees, staff in the long-term care settings, the government, and perhaps other stakeholders as well. There is connectivity that is being created to name things, and that collectivity wants to see the adoption of a continuous approach. In this idea of continuity, what I mean is that we will always want to fight elder abuse, and parallel to this, we want to promote well-being. So I'm coming back to the second word that I want to comment on, and that is the well-being. So treating well. What does that mean exactly? It's a notion that it's quite new in Quebec. It was brought up in the second government action plan to fight elder abuse in 2017, and people are more and more taking ownership of it increasingly. So now we will bring together actions, we will fight against elder abuse, and at the same time we will promote something that is much more broad, that is well treating or treating well. To define what this concept is, I'm going to cite one of my colleagues in French, Dr. Smith. He says that treating well is an objective, an individual and collective objective that rests on values that are shared, that are not built in the abstract concepts, but in the reality of human relations towards which we have to move. We have to meet the expectations of a society that is in constant evolution. So this concept is a horizon of values. It is also a horizon of heart. And I'm convinced that if you are here today, it's because you've got this notion of heart within you. At the chair, we wanted to try to give clearer indications so as to see how elder abuse is manifested and how we can eradicate it. We will start by paying attention to the context of a person who is in a care facility. They've got their culture, their beliefs, their rights and freedoms, their own life experience, because they're all unique. So every person is unique, and they've got their values. If I work in treating well these residents, that means that I want to promote values. These values are dignity, the self-esteem, inclusion, participation, because a person is not just there to receive care and services, they are there to participate in a project. The recognition of each person, the respect, and of course, the safety. To put all of this into application, if I want to treat other people well, first of all, it's my attitude, but also the attention that I pay. And all of this is translated in actions and in practices. So we understand that treating people well is in an organizational culture and in social relationships. We could say that it also is integrated in interaction and in interrelationships. In the government action plan to fight elder abuse, the government has proposed 6 big conditions so that we can have a well-being approach. First of all, there was a first condition to put the person at the center of our actions. The second is to foster their self-determination and their empowerment. The third one is to respect the person and their dignity. The fourth, to foster the inclusion and participation, social participation. The fifth is to intervene with our know-how, that is to have the skills to be able to intervene, but also to know how to be, how to behave, to refer and to exercise our judgment. And the last point, and not the least, the sixth condition is really to offer a support that is concerted, so we work together. The third term or word on which I want to come back is the respect of rights. Unfortunately, we have a tendency to see people in long-term care facilities as people who are in a vulnerable situation and who have needs to be filled. What a restricted vision. These people have rights. And in fact, over the past 3 years, I've participated in works that aim to prepare an international convention on the rights of the elderly, and one of the convictions that we share is really to say that when we have a convention, this allows to make people visible because we name them as being humans who have rights. So in Quebec, we've got rights, and these rights are integrated in several tools. I'm going to talk to you about 2 tools. Firstly, the law on health and social services, which recognizes 12 rights, 12 user rights. I'll give you a few examples. I'm not going to name them all. Rights to services, right to consent or to refuse care, the right to participate in the decision-making process, the right to have access to a user file, and the right to receive services in English. The other mechanism that is very important is the Quebec Chart of Rights and Freedoms, which recognizes fundamental rights for all, including the right to life, to safety, to integrity, to freedom, and to dignity. But in addition, in the chart, there's Article 48, which has to do specifically on elder abuse and handicapped persons abuse. So I know that the question of advocacy will be the motor behind your actions today. So all of the conferences and the workshops, you will get tools to recognize your rights. You will advocate for the respect of these rights and defend them. I wish you a wonderful day of sharing, but mainly I invite you to take advantage of this day to really inspire yourself and reinforce your practice. I'm going to cite a colleague in France who I like very much, Alice Casagrande, who says, the first step in treating well, is to stop the repetition of failures and of misunderstandings. In other words, she invites us to take a time to stop and think about this, and this is your day, and it's a time to stop, to analyze what's not working, to find and to apply solutions, and to promote change. To each one of you, I wish you a wonderful day. To each one of you, this notion of togetherness. And it's because I worked 30 years in the field, this is what is missing the most, this notion of working together. And I think that if at the end of this day we manage to leave from here by saying we all have a role to play personally and collectively, well, we will bring about this change in our health network, this change for those that we love now. Those who have left, it's too late, but they have taught us lessons. And for those who are coming, well, perhaps it's somebody close to us or ourselves who will be the next ones to go through this system.